This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Lupihope Tablet is an effective solution for managing hormonal imbalances in women. It addresses a variety of issues linked to progesterone deficiency. Indications and uses. This tablet is indicated for relieving menstrual pain, managing symptoms of endometriosis, and addressing premenstrual syndrome. It also serves to enhance female reproductive health by correcting hormonal imbalances and alleviating the discomfort associated with menopause, such as hot flashes and mood swings. How it works. It works by improving the thickness of the uterine lining, thereby addressing infertility issues and irregular periods while relieving postmenopausal symptoms. Directions for use. Take the tablet as prescribed by your physician. Swallow it whole with a glass of water without chewing or crushing. It's best to take it at the same time each day, with or without food, as advised by your doctor based on your individual health needs. Possible side effects. Common side effects may include headaches, nausea, breast pain, and irregular periods. If these persist or worsen, consult your healthcare provider. Precautions and warnings. Consult a doctor before usage if you have liver problems, depression, or are pregnant. The tablet is contraindicated in individuals with certain tumors or blood disorders, and caution is advised for those with kidney issues. FAQs. 1. What is Lupihope Tablet used for? It is used for managing progesterone deficiency. 2. How should it be taken? Swallow it with water as prescribed, without chewing. 3. What are the common side effects? Headaches, nausea, and breast tenderness are common. 4. Can I stop taking it suddenly? No, do not stop without consulting your doctor. 5. Is it safe for children? It should only be used in postpubertal girls if prescribed. Thank you for watching. If you have any questions or suggestions, please leave a comment below. We appreciate your feedback.